Hi, welcome back, everybody. The Lifetime Achievement Award presentation is to Henrietta Van Huel. One of the most enjoyable, one of the most enjoyable parts of being president is having the opportunity to honor occupational health nurses for their professional and community excellence. Before commencing the annual general meeting, I am proud to award the association's Lifetime Achievement Award to Henrietta Van Huel. Yay! The Lifetime Achievement Award recognizes an occupational health nurse's outstanding contribution locally and provincially, and in Henrietta's case, nationally, to the occupational health nursing specialty and our association. An Oohna member for over 18 years, Henrietta has received her RN diploma from Fanshawe College in 1984 and her own certificate from Fanshawe in 2006. She received her Bachelor of Nursing and Masters of Health Science Management from Stewart University. Throughout her career and in her current position as Vice President of the Public Services Health and Safety Association, Henrietta advocates for the healthcare sector and for occupational health nurses. Educator, mentor, researcher, Henrietta's contributions include being the co-founder of the National Alliance for Safety and Healthcare, in which the majority of provinces in Canada are actively involved, being a co-principal investigator for research associated with workplace violence, developing a clinical practice assessment tool to keep mental health workers safe, research toward the prevention of health and safety, impact from slips, trips, and falls for workers in long-term care settings. Henry has also been closely involved with the Queen's University study of leading indicators for occupational health and safety management systems in healthcare. She has been a key disability management instructor at Mohawk College for the National Institute of Disability Management and Research and a guest lecturer at the Dalai Lama School of Public Health at the University of Toronto. Throughout her years of service, Henrietta Van Huel has gained repeated respect from recognition from provincial, national, and international peers and colleagues. On behalf of the Oohna Board of Directors, I thank you, Henry, for your passion and your commitment to promoting our profession.
Thank you, Karen, for the kind words, and thank you, Drew, and the Board of Directors at Oohna for this award. I am deeply honored to receive this, and the fact that it's from my peers makes it even more special. I do want to start with a few words about the pandemic that we're in the midst of. Occupational health nurses are really critical right now for supporting the safe operation and the reopening of so many workplaces in Ontario. Our expertise is needed in both the planning and the execution of health and safety protocols. To all my fellow OC health nurses and to the essential workers you've kept safe and healthy over the last 3 months, thank you so much. I'm extremely grateful for the choice I made many years ago to be a nurse. Thanks for putting the date in there, Karen. And also for the decision to become an OC health nurse after 17 years in med-surg. For those who know me, health, safety, and wellness is something that I live and breathe every day, and applying that to the health and safety of workers was a perfect fit for me. Karen mentioned some accomplishments that I'm proud to be part of, but no person is an island. We all have people who support us along the way, and I do want to take a minute to thank some of the OC health nurses who've been part of my journey. Back in 2001, Denise Madsen came up to me and said, "Have you ever thought of occupational health nursing?" Well, that started it all. And shortly after, I started my OC health journey at Tillsonburg Hospital and applied that very year to be a member of Oohna. When I was completing my OC health nursing certificate, I had the pleasure of learning from some amazing OC health nurses who were on faculty at Fanshawe College. You may recognize some of their names: Karen Erskine and Marlene Demko. Thank you for sharing your wisdom. I also learned from so many OC health nurses that I've been lucky to work so closely with: Patty Boucher, Catherine Nickel, Peggy Swearhun, and to my fellow OC health nurses at PSHSA, Liz Sisolak, Alina Shapovalov, Janice Gallant, Tina Dunlop, and Connie Limnitis, thank you for nominating me for this award. It's a pleasure to work and learn from you and the rest of the brilliant staff at PSHSA every day. In my current role, I'm lucky enough within the prevention system that I get the opportunity to work with so many dedicated and committed people across the province who, like Oohna, are working to achieve positive health and safety outcomes. To the PSHSA leadership, initially Ron Koleski and now Glenn Cullen, thank you for the opportunity and support as we've worked on projects like the Violence in Healthcare Toolkits and websites, the Infectious Disease Risk Assessment Tool, which is being used a lot right now, and our upcoming website and resources on occupational stress injuries in nurses, just to name a few. To me, one of the key components of the success of these projects is collaboration. We listen and we learn from our stakeholders, and they are the experts about the work, and we need their voice if we actually want to get it right. I do want to conclude by thanking my family for their support and patience as I shifted careers and went back to school. And as Karen said, after I completed my Occ Health nursing certificate, I went back and did my bachelor's and then my master's. Thank you to my husband for all of his support. Perhaps one of my greatest achievements was getting him to marry me. You know, I couldn't have done it without him. And to my other three greatest achievements, my now grown children, thanks for giving me the time for classes, studying, and assignments. I do want to finish by saying I'm extremely proud to be a nurse. I'm proud to be an occupational health nurse, and I'm really thankful that we have Oohna to support and represent our profession, where right now, more than ever, we are all needed to keep workers safe. Thank you again for this award.
Henrietta, thank you so very, very much. It's very well deserved. And thank you very much. So you're going to have to jump onto the AGM now.
Okay.
Thank you.
Thank you.
Okay, everybody. So at this time, I would like to welcome everyone to the 2020 virtual annual general meeting of the Ontario Occupational Health Nurses Association and call the meeting to order. The chair wishes to acknowledge that there will be a motion presented at this meeting and that no parliamentarian is present. Any unresolved items will be held over to the 2020 AGM. This AGM is being presented using two virtual platforms. Myself and Executive Director Drew Sousa are on Zoom, and members are viewing the AGM via link on YouTube. The voting process will go through data on the spot. When a vote is called, data on the spot will email AGM attendees a link where you can cast your vote. The data on the spot will tabulate the votes each time. The process of each vote will take approximately 90 seconds. So I would like to introduce the Board of Directors for the 2019-2021 term. Amy Connell, Stephanie Ireland, Agnes Lucier Down, and Lena DiCarlo. And I am Karen Watson, and your president. And I would like to introduce your association staff. Drew Sousa, Executive Director, and Olivia McGeever and Francis McEsworth. Time limits. In order to facilitate the business of the day, a time limit of 5 minutes will be placed on the discussion of any one item. Francis McEsworth will be the timekeeper. Whoops. Sorry. Voting will be carried out by members keying in their votes online. The recording secretary for this meeting will be Francis McEsworth. The session will also be recorded for reference. The association has a process in place for making motions. All motions must be presented to the Bylaws and Resolutions Committee in advance of the meeting date. At the AGM, any motion must be of a general nature and presented in the form of a recommendation to the board. There is one motion being presented this year. Data on the spot is facilitating voting at the AGM and will determine a quorum. Only Oohna members may respond. Um,
Confirmation of quorum?
oh, yeah, confirmation of quorum will be from data on the spot. At this time, I'm going to ask data on the spot to advise if we have quorum.
We have quorum.
Okay? For the minutes, we have quorum.
Are we opening the minutes?
Do we need the numbers, Francis?
No, we're okay. We just need that the quorum has been established.
Oh, we haven't voted on it yet.
No, we.
Uh,
Yeah, we're good. Yeah.
Noting that we have quorum, I declare the meeting duly constituted for the transaction of business. Minutes of the 2019 annual general meeting were part of the annual report, which was posted to the Oohna website with the link being emailed to each member. These minutes are not normally read. Were there any errors or omissions noted? The chair will entertain a motion to adopt the minutes of the 2019 AGM. A motion made by Ken Storin, seconded by Stephanie Ireland. All in favor?
We have to wait for the.
Yep, so we're waiting for the all in favor?
Yeah.
Yes, motion is carried.
We're waiting.
Oh, we're still waiting, I'm sorry.
So I have to wait until we get a certain number of votes, right?
Okay, have they not voted?
We're just waiting for you guys to vote. Hopefully you're voting.
We have 2 votes coming in now.
Well, we have 2. Thank you. Thank you to those 2 members.
Everybody else vote.
And there's 3 of us here,
Oh, it's 5.
right?
Yeah, so we all vote, say yes. We're in favor, so that's 5.
We have 3.
6, 8.
Maybe 15? Do we have 15 out there?
How many are attending?
Okay, the motion is carried. Thank you, everybody. The annual general report for, sorry. Okay, to keep the AGM on time, we decided to combine the executive director's report with the board of directors report, which I will now present. 2019 was an election year with Amy Connell and myself deciding to stay on for a second 2-year term, resulting in 3 vacancies, which were filled by Lena DiCarlo, Stephanie Ireland, and Agnes Lucier-Doe. Thus, the board, sorry, I'm trying to scroll up here. Sorry, I'm having some technical difficulties. There we go. Thus, the board was acclaimed for the 2019-2021 year. The new board chose myself to continue as president and Amy Connell to be secretary. At the 2019 AGM, I thanked outgoing directors Norma Bonner, Norma Segreto, and Linda Doan for their vision, commitment, and dedication to the association and the profession of occupational health nursing. In 2018, Executive Director Drew Sousa successfully negotiated with the Mental Health Commission of Canada for Oohna to be one of a few organizations licensed to offer the Working Mind workshop. In May, Oohna launched the Working Minds at the 2019 annual conference and delivered 2 additional workshops, helping to add to our much-needed revenue for the association. It is our belief that occupational health nurses are the best professionals to handle mental health in the workplace because we have the credibility and trust of the employee and employer community. This is the message you and your board and executive director continue to communicate to the WSIB, WSPS, PCSH, Ministry of Health, Ministry of Labor, Ministry of Health and Long-Term Care, and employers. Being a provider of the Working Mind strengthens our credibility even more. Oohna continues to be committed to ensuring that we actively participate in the educational opportunities available within the health and safety arena. Oohna's 6-week course, The Essentials of Occupational Health, Safety, and Disability Management, enjoyed increased attendance at both the spring and fall 2019 offerings. The disability management module was updated, and a different module will be updated annually to ensure the course remains cutting edge. The course continued to attract more disciplinary registrants from HR, occupational health and safety management, RNs, and WSIB specialists. Oohna continued to provide complimentary registration to 4th-year nursing students per course, which resulted in a student finding employment in the field. 2019 also saw Oohna formalize and strengthen our relationship with 2 local colleges by signing memorandum of agreements with each of them. With Mohawk, the memorandum of agreement gives Oohna's Essentials course an equivalency status under Mohawk's Certificate of Occupational Health Nursing Program. With Humber, the memorandum of agreement allowed Oohna to coordinate the college's occupational health and safety component of its health and wellness degree program. This provided another revenue source and, more importantly, helped to support our members' professional growth. 2019 was a very busy year for Executive Director Drew Sousa. She actively represented Oohna in numerous presentations throughout Canada, helping us to raise her profile while educating members of the business community in the vital role we play in the workplace. In January, she presented a well-received webinar to the Nurse Practitioners Association of Ontario on what is occupational health nursing. On May 1st, Drew participated in the Workplace Safety and Prevention Services 2019 conference, presenting the session, The Role of the Occupational Health Nurse in Managing Mental Health Claims. Later in May, she presented Creating a Positive Environment for Employees for Mental Health Issues at the 2019 Canadian Association of Municipal Administrators. At the request of the Mental Health Commission on June 4th, Drew presented Implementation of the Psychological Standards in the Workplace at the Canadian Energy Pipeline Association Foundation meeting in Calgary, Alberta. The year concluded with Drew presenting Creating a Positive Work Environment for Employees with Mental Health Issues at the Schedule II conference, and then Inclusive Job Design and Policies to Protect Psychological Safety and Prevent Legal Liability for Osgood Certificate in Workplace Mental Health. We also continue to seek opportunities to ensure occupational health nurses were actively contributing to changes in the health and safety industry. In April, Drew attended the Mississauga session of the Ministry of Labor's Occupational Health and Safety Strategy consultations to ensure Oohna's contribution to the development of the next Occupational Health and Safety Safe at Work strategy. Throughout the year, the executive director represented the association on the Occupational Dermatitis and Healthcare Committee, chaired by Dr. Lynn Holness. This committee completed the development of the occupational dermatitis protocols for healthcare settings late 2019. Drew also was asked to represent occupational health nursing on the Canadian Standards Committee that developed the CSA Standards Workplace Disability Management System, said 1011. She will be presenting the standard at the opening of the 2020 Oohna Annual Conference. Keeping Workers Well 2019, the 48th Annual Conference saw a return to breakout sessions and a choice of multiple workshops, which attendees had asked in their 2018 conference satisfaction survey. Chief Prevention Officer Ron Kaluski opened the 2019 annual conference, and the welcome reception was replaced with a sponsored mix and mingle at the end of the first day that was well attended. The exhibition sold out with a waiting list. Sponsorships sold out and attendance remained stable. The annual conference continues to be the main source of non-dues revenue, while the 8 webinars delivered in 2019 resulted in a modest profit. In mid-2019, your board of directors placed an RFP for a new insurance broker. Willis Towers Watson became the association's new broker, with Aviva contracted to provide insurance. While our rates have remained relatively stable, members have experienced insurance renewal issues that the broker has promised to rectify for the 2021 membership renewal process. Thanks to members' generosity and commitment to volunteerism, both the mentorship, ambassador, and preceptorship programs continue to thrive. The association received a lot of positive feedback from new members who benefit greatly from the support of a mentor. Your board held 6 meetings in 2019, including a business strategy planning session. At the March 21 meeting, your board agreed we needed to develop a business strategy in order to create a strategic plan to support the business model. To achieve this, Michael Anderson, Tucker & Associates, facilitated a business strategy session on October 10th, 2019. Pre-COVID, this session resulted in the development of the 2019-21 strategic plan. Part of the plan was to strike an education committee responsible for sourcing all education topics and speakers for webinars, conferences, and workshops, as well as article topics and authors for Oohna publications. The committee held its first conference call on December 12, 2019. Susan McIntyre chairs the committee, which plans to hold monthly conference calls. At the June 6 AGM, the membership approved the board recommendation to eliminate the affiliate category of the membership and allow RPNs and LPNs to join Oohna as regular or associate members. RPNs and LPNs receive all the benefits of regular membership. It is hoped the association will attract new members to mitigate the increasing number of retiring members. In October 2019, the board of directors agreed with Drew's cost-saving recommendation to operate the association office 4 days a week, Monday through Thursday, and operate with part-time staff working 1, 2, and 3 days per week, ensuring the office is staffed all 4 days with 1 or 2 staff. This decision coincided with the departure of Susie Benejby, who was replaced by Olivier McGeever. As office coordinator, Olivia works 3 days a week. Associate Executive Director Frances McCusworth accepted a position with another organization, but arranged her schedule to continue to assist Oohna 1 day a week. Nellie Henderson returned to assist Oohna 1 to 2 days. For the financial report, the chair calls upon Executive Director Drew Sousa to present the financial report for 2019 and the 2020 budget.
Thanks very much, Karen. The financial report. Each member has had access to the 2019 annual report. Will have access to the complete audit as performed by the firm of Clearhouse LLP. This continues to be a rigorous process which includes questioning some of the board members, the staff, and the executive director. Under Oohna's government policy, the executive director is responsible for finances. We are disappointed to report that, as in past years, Oohna's operating expenses continue to exceed our revenue, and once again, we're operating at a loss. I want to highlight for you exactly what I mean by that. So if you take a look at this particular slide, you'll note that our revenue in 2019 was $227,675, while our expenses was $284,600. This led to a deficiency of $56,925. Fortunately, our income, our gain from our marketable securities was $63,287,000, which led to an excess in our expenses compared to revenue of $6,362. Again, our losses continues to be offset by several cost-saving measures put in place by the Oohna team, including, as we've previously indicated, moving from full-time to completely part-time staff and closing the office on Fridays. I'm also pleased to say that the ongoing commitment of our team has stemmed any impact that this may have had to the members, and we have not altered the scope and breadth of services to our members. Furthermore, despite reduced membership numbers, in 2018 we had 561 members, and in 2019 we had 529 members. We continue to increase revenue generated by Oohna's education events. However, as I previously indicated, once again, the strength of Oohna's investments portfolio has allowed us to minimize the negative impact of our continued loss of members. This, of course, most likely will not continue, given the fact that, of the market instability as a resulted of COVID. If you take a look at our other details as outlined by the next slide, in 2019, we only had a small decrease in our net assets, going from $494,433 to $491,322. Again, this will change significantly as a result of COVID and the marketplace. So, folks, I don't know how else to say this. I'm imploring you, I continue to encourage you, please, 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 as active members, vigorously promote the value and benefits of memberships in our association, particularly the mentoring and education. I can't tell you the number of phone calls we've been receiving over the course of the last several months of people very interested, nurses very interested in exploring the opportunities that occupational health nursing provides to them. But we're going to need your help in all of this. These include NPs, RPNs, and RNs. We need all of us to step up to the plate and help our association grow as the specialty of occupational health nursing gains recognition in these trying times. The reality of it is we're faced with a lot of challenges, and unless we work together, those challenges cannot be fully realized and cannot be fully contained. What I'd like now to talk to you about is the 2020 motion to appoint auditors for the 2020 year. So I, Drew Sousa, Executive Director of Oohna and a member in good standing, move that the chartered accounting firm of Clearhouse LLP be appointed as auditors for the association for the year 2020. And a seconder would be Ken Storin. We're going to take a moment to vote. So please, all of you, take a moment, use this moment and this opportunity to vote. We ask you all in favor. So we'll take a moment and ask you please to vote.
The vote is open.
The vote is open. I've been asked to remind everybody that if you're already logged in on the screen, just click the next vote button, and that will allow you to vote on this motion. Thank you. So we've been informed that the motion has been carried. Great. Thank you very much for voting, folks. Bylaws and Resolution. The members of the Bylaw Committee are Carol Grossi, Ann Lorimer, and Rosalind Wright. The Executive Director acts as the chair, so I will present the proposed resolution. There is a resolution for presentation at this meeting, presented by the Board of Directors. The resolution states, from March 2020 onwards, associations across Canada felt the impact of COVID-19 in many ways. Most associations had to curtail an ongoing implementation of their strategic plan, as well as to cancel or replace face-to-face conference with virtual events. This is the case for Oohna. 2021 was supposed to be a nominations year for the Board of Directors. However, the current board has been unable to bring to fruition key elements of its strategic plan. And believe me, folks, we worked really hard to try to make this happen. To address the situation, the current 2019 and 2021 Oohna Board of Directors makes the following motion. That the 2019-2021 Board of Directors be granted another 2-year term, that's 2021 to 2023, in order to complete their 2-year strategic plan that has been curtailed due to COVID-19. If approved, the next call for nominations to the Board of Directors would be in January 2023, with the new board taking over for a 2-year term on September 1st, 2023. Any discussions? So I'll just give you guys a minute if you need to relate to us any concerns. So we've had no discussions. So I'm going to ask for a vote. I'm going to ask, a seconder for this motion, and that would be Susan McIntyre. All in favor? So I'm going to give you a few minutes to vote.
Open.
The vote is open. I've been asked to remind everybody to press next vote button again, because that will refresh your page. So we just closed the vote and we're checking for results, and the results indicate that the vote is carried. Thank you very much. I'm now going to ask our president, Karen, to come back. No, Karen says no, she doesn't want to come back. Okay, I'll just ask, is there any other business arising from the floor? Or if any member has a question, please key it in at this point in time. So we'll give you a couple of minutes to take an opportunity to ask for those questions. And we sincerely hope that you've enjoyed this new way of us presenting both the conference and at your AGM. We're feeling that this provides an opportunity for our members across the country, across the province to be able to participate. So we're really excited at that opportunity.
Okay, go ahead.
I was just saying, everybody, I must admit I don't like being on camera. Okay.
Can you just ask on the stream for business, new business?
Okay, if there is no further business from the floor, I declare the 2020 virtual annual general meeting closed. Thank you for coming and stay safe and well.
Bye.
Bye.
Bye.